national health care bill. I used to call it the train wreck that was coming, but it's obviously the train wreck that's here. Before I do that, I'm on 980 KMBZ. I used to be on 710, but I moved. That's all right. I moved to 980 KMBZ about a year ago, and we've been very fortunate, very blessed to be over there. I will be at the Tea Party on the 15th with Darla J on the air, doing her show on the 15th at the Tea Party, so I look forward to seeing you all out there. You know, I travel around the Midwest and Southeast a lot. We're in St. Louis, Louisville, Carterville, Carbondale, Illinois, some of the other garden spots around the country. And so I get to see a lot of interesting things. I was in Springfield about a year ago, and I was going out to our radio station, KSGF, and it's out in a rural area. It's not in the city. And I have a pickup truck, and I'm behind this other fellow, and he's in a pickup truck, and there's no traffic lights or just stop signs. And I see this guy in his pickup truck, and he's got a gun rack in the back and some hay bales. I see this bumper sticker, PETA. I'm kind of like, well, that's a little odd. Out here in the middle of Springfield, he's got a PETA bumper sticker on. So I try to get up to him, he takes off, and I can't read the bumper sticker. And I go to the next stop sign, I pull up next to him, and there's that bumper sticker, and I look over there, and it's PETA. People enjoying tasty animals. Which just goes to prove people in the Midwest aren't drinking the Kool-Aid just yet. So what's going to happen? Well, let's talk about it. It's passed. It's here. Are we going to be able to do anything about it? I'll talk about that toward the end of my discussion tonight. But let's talk about what's going to happen immediately. The first thing that's going to happen in 2010, these are the things we're going to see happen. Pre-existing conditions go away. So if you're a person who had pre-existing conditions, you'll be able to buy health insurance from a federally mandated pool funded by $6 billion out of this bill. So that's the first thing we're going to see, is we're going to see this federally mandated pool. Anybody that wants health insurance will be able to get it out of the pool. Now, I did see the other day that Kathleen Sebelius, lovingly known in Kansas as Governor Kitty Cat, is talking about using the state pools to run this thing, and they're going to fund the state pools. The state pools have always been there and have always been available for people to buy health insurance regardless of their conditions. The problem with them has always been the price. So hopefully this $6 billion is going to allow people to get it for a much more reasonable number. That's the first thing that's going to change. That should happen within the next 6 months. The next thing that's going to happen is small businesses are going to receive a subsidy. Now, you may have seen President Obama, when he was in Ohio, I believe it was, not very long ago, he was on his road tour talking about the bill and trying to convince the American public that they truly were going to be happier once they learned the details than they were before they learned the details. Well, what we found was, when we drilled down into the small businesses that are going to be helped by this, is they're very, very limited. Now, President Obama stood in front of this audience and said small businesses are going to be able to afford health insurance. Yes, you will, if you have no more than 25 employees and nobody makes more than $27,000 a year. The trouble with this bill is when you get down into the details, this 2,700 pages of sausage, which they're going to turn into 100,000 pages of regulation. When you start looking at what it's doing, one of the biggest problems you're going to see with it, one of the biggest problems that I've done an analysis that's been from one end to the other, is the concentration of power in Washington, D.C. Everything is run through Washington, D.C., and I'll talk more about that in a minute, but that's the single biggest thing that I think people need to be aware of, is this enormous concentration of power in Washington. Under Health and Human Services, Kathleen Sebelius, under the new Health Choices Czar, we're going to have another czar, okay? That's going to be your Health Choices czar, who will make choices for you, okay? And under the Medicare Commission that's going to be appointed. Note that none of these people that I just talked about are going to be confirmed to the Senate. They're going to be appointed. And those people are going to make the decisions about what you can and cannot do with health insurance. No limits on policies, that comes off this year as well. So if you had $1 million limit on a policy, that'll go away. Policies will be unlimited. Children up to age 26, if you want to keep them living in your basement, now you'll be able to give them health insurance, and they can live in your basement with health insurance. So children up to age 26 will be on the policies. Those are the things that are going to happen this year. Here are the unintended consequences of what's going to happen as a result of this. You know, in traveling around the country, I meet with a lot of executives in this industry, the president of Anthem WellPoint in St. Louis, president of Blue Cross and Blue Shield of Kansas City, president of Assurant, all these different people that are in this business. And one of the things that I thought was interesting was, because the way I looked at this was not until 2014 are we really going to start to see any significant impact on pricing, because in 2014 the exchange dials in and then we get into the mandate situation. But that's not the case, and here's why. Insurance companies are already laying out and going through their process of understanding what actuarially the impact is going to be on them when the pre-X comes off in 2014 and anybody can walk on the pool or onto one of these plans, because the pool will dissolve in 2014, and then we will have the government-run exchange, which will force the insurance companies to offer certain types of plans. So the carriers are already looking at what is the cost impact going to be to us when you throw the doors off. Well, it's going to be huge, and let me tell you why. The way this was supposed to work, the way that the America's Health Insurance Plans, the Blue Cross and Blue Shield associations, the National Association of Health Underwriters, and the Big I independent agents all sat down with the Obama administration, the Democrats, thought they had a place at the table. In reality, they were a line item on the menu. But what was supposed to happen was the mandate was supposed to dial in at the same time as we put this exchange, or we open the doors for this thing to let everybody come on these plans. Now, whether you like the mandate, agree with it, or disagree with it, at that point is irrelevant. What I'm talking about is the economics of this thing. In order for this to work, you have to have enough people come on the plans to offset the cost of the people that are coming on the plans with the issues. The problem is the mandate dials in 2014, but the penalty is $95. Well, let me ask you a question. If you can pay a $95 penalty or pay a $200 or $300 premium at age 21, what do you think you're going to do? Okay. If you're an employer and you can pay a $750 penalty or a $2,000 penalty versus buying a group health insurance plan that's going to cost you $25,000 to $30,000 a year, what do you think you're going to do? So what's going to happen is they're going to put this exchange in place, they're going to put this mandate in place. These people are going to come on this plan, they're going to come on these plans that are set up by the federal government, and they're going to be run by the insurance companies, but they're going to dictate to the insurance companies what they can and cannot do. Insurance companies are going to become, in effect, utilities. That's what they're going to become. So they're going to put this thing in place, and then all these people are going to come on, and premiums are going to go like this. Now, the exception to that rule is if you have a plan in place, and this is a little known part of this bill.